Okay, well, welcome everyone, and thank you for joining us this afternoon. I know it's probably a lovely day for everyone, so we appreciate you all taking the time to meet with us and talk about this important topic of gun violence. Uh, the virtual forum, Gun Violence in the 21st Century, Its Effects, Treatments, and Solutions, sponsored by the Gun Violence Resource Group. Our presenters for today include myself, Dr. Berkowitz, Dr. Fritz, Dr. Randawa, Dr. Suresta, and Dr. Simpson. We'd like to acknowledge our additional members that were unable to attend today, but are here in spirit, of course. And also, before I start, I would like to dedicate this session to one of our colleagues who recently passed away, Dr. Marion Swoop. Okay, so today I will be your facilitator for this presentation, and we will have our presenters do various topics involving gun violence research. Just some housekeeping issues first. All attendees will be muted with cameras turned off. If there are any questions regarding logistics or technology questions, please direct that to the AACAP staff, which can be entered into the chat. Our questions for our panelists will be taken in our Q&A section, which is at the bottom of our Zoom. And it's open at all times, so you can just enter in your questions, and we will answer as many questions as possible at the end of our talk. Let's see. I think with that, I want to say, I guess we will get started with our agenda. So, as I mentioned with our topics, we'll start with from victim to perpetrator with Dr. Berkowitz, gun violence, including suicide and LGBTQIA+ youth with Dr. Simpson, urban gun violence and systemic disparities in BIPOC youth with Dr. Randawa, rural gun violence and extreme risk protection orders with Dr. Suresta, lively discussion on Guns 101 for gun control advocates with our own Dr. Fritz. And I will end it with empowering physicians and families on firearm safety and education, which at that point we will have last thoughts and do our wrap up of any questions. And as we mentioned, this is being recorded, although it is a live session as of today, but it will be recorded and we will post it on our website for future viewing. Okay, so without further ado, let's go to the learning objectives. We hope that by the end of this session, these objectives will be a reality for you. And yeah, I guess we can get started with our presentation. So once again, welcome to the Gun Violence Resource Group Virtual Forum. Prevention of gun violence is not one size fits all. Solutions will vary. So without further ado, I would like to introduce Dr. Berkowitz to get started with our presentation.
Thank you, Dr. Adam. Good morning. It's morning for me, afternoon for many of you. Just by way of introduction, I'm at the University of Colorado School of Medicine, where I've been for 6 years. And I am actively involved in what we have a firearm initiative prevention program here on campus at the University of Colorado, which I'm on the member of the board. Next slide, please. Okay, that's my disclosure. Next slide. So I'm going to start with a story of somebody that I recently worked with. So Kevin's 18 years old. He grew up in the Memphis area in what was a very, violent neighborhood, lots of gang violence and so forth. His father was an alcoholic and was physically and emotionally abusive. His mother was a very nice woman, though very passive. 2 years prior to my meeting Kevin, he and his best friend were walking in their neighborhood. Shots rang out, and Kevin felt blood dripping down his face. He looked around to find his friend on the ground, bleeding profusely from his abdomen. Um, I should say Kevin immediately attended to him, called 911, tried his best to staunch the bleeding. But unfortunately, Kevin's friend was paralyzed and has a permanent tracheostomy. He cannot breathe on his own. Kevin was really the primary caregiver for his friend for that first year. Next slide, please. Days after the shooting, Kevin purchased a gun. Um, and he basically said that at that point, he learned that you have to do it to them before they do it to you. And he probably developed PTSD after the shooting, at least based on history and my evaluation. Um, while visiting a family in another state, that is Colorado, he and his friends were at a local park when several older men in their 20s who were drunk began harassing them. One of his friends got involved in a fist fight with one of these men who were harassing them. Kevin and the quote leader of this group of men tried to defuse the situation. But then Kevin was pushed into the leader, who then reached into his back pocket. Kevin pulled out the gun, shot, and killed him. Next slide, please. This is unfortunately something that, at least in my work, we hear with some frequency. And just to give you some idea of the national perspective of this, many 5.4 million people were violently exposed and victimized in 2016. And children, particularly adolescents, are at a much higher risk to be victimized, and that reportedly 61% of youth were exposed to violence in the past year. And 39% of children and their caregivers reported a direct victimization. Those are pretty amazingly large numbers if you think about it, right? If we're talking that about 40% of kids were direct victims of violence. So there's some theories out there, and I will say that my feeling is they're all true and they all interact. There's not any one of them that in and of itself is accurate, but clearly intergenerational transmission, something that many child psychiatrists know and think about a great deal. It's a social learning theory that violence is passed down, and there's a cycle of violence throughout. And that there's a belief, based on experience, that violence is an effective problem-solving technique, particularly when other options like discussion, negotiation, really have not been taught or reinforced. And then there's what's called the routine activities, lifestyle perspective theory, that lack of supervision combined with relationships with, quote, deviant peers allows for individuals to commit violence. And it's the same variables that put them at risk for a victimization. Similarly, there's a social disorganization theory that suggests that the environment and peer group membership lead to victimization, which then influences offending. And I think, this is something we all know about and we see as well. And I have some theories about, gang involvement, particularly around safety, protection, and the idea that this is really where you get your social support from. And then there's strain theory, which is, coping in response to being being exposed to violence, which allows for a strain, and that it believes that people learn offending behavior due to their own victimization experiences. So if we go back to Kevin, while he was not a gang member, certainly the first and the second theories really apply to him. I should add that his friend was a gang member, and that may have been why they were actually victimized. Next slide, please. So here's some literature based on, thinking about traumatized and victimized youth. Um, so impaired decision making being, obviously an important piece of this. So prior victimization influenced decision making in situations that resulted in violent offending. And we know that traumatized individuals do have difficulty with decision making and judgment. There's also this issue that, there are common characteristics and behaviors. College students who are victims of assault and their offenders had, really multiple similarities. There's a lot of overlap. They are more likely to be male with similar lifestyle behaviors, such as arrests in the past 6 months and buying or selling illegal drugs. Again, I think this is something that we're all clinically aware of. And then learn from experiences. There was a meta-analysis by Stith and colleagues that revealed a relationship of growing up in an abusive family, resulted in being involved in a later violent marriage. So that the victims learned that the violence from their experiences influenced their perpetration of violence. Again, I think all of these are true, and there's not any one of them, but these are important when we're thinking about gun violence, intervention, and prevention. Next slide, please. So gun violence is, guns are ubiquitous. As you all know, there are far more guns than people in the United States. And when you have a gun on you and you have it available, why get into a fight when you can shoot and resolve it quickly and maintain your survival in these situations? So, as mentioned, the youth that, with these experiences are more likely to be dysregulated, impulsive, and aggressive. Again, this is what we know about traumatized individuals in general. Um, Also true is they are more likely to praise experiences as threatening and dangerous. Again, these are trauma reactions. Multiple studies have shown that traumatized individuals and children see neutral faces as dangerous when compared to others. So if you are more likely to see these experiences as dangerous, then you're more likely to try to buy a gun for protection. And you're more likely to commit a crime with a gun, even though you don't really intend to use it, which in fact was the story with Kevin. So we see that this cycle here of more guns increases exposure to guns and therefore increases the risk of using a gun in a violent episode. Next slide, please. Solutions. First, much to my chagrin, and I'm sure many others, any really effective gun control is really off the table these days. Anecdotally, here in Colorado, the second time assault rifle ban was proposed, got through committee, died yet again in the legislature. So what do we need to do? We need to focus on gun safety, things like gun locks. I think we, as many others, we hand out gun locks in our pediatric practices, our general primary care practices. We have a group of people who go to gun shows and distribute gun locks. Clearly, that is probably as good as we can do. We're also increasing our approach to using gun boxes, which are certainly much safer than gun locks. Smart guns. This is evolving technology. We should think about how do we incentivize the use of smart guns. That's a gun that will only operate with the owner's fingerprint or signature. Training on use, it's kind of crazy to me that in many states you don't have to get trained and get a license like you may for a vehicle, for a car. And then much better enforcement of illegal guns, ghost guns, those sorts of things would be very useful. We have to focus on prevention. One of the things we need to do is prevent maltreatment, which we know is a major pathway to violence perpetration. So we know that a livable wage decreases maltreatment. That is something that I think as child psychiatrists, and we know that the financial stress is a leading cause of trauma and violence, we should really be advocating for. Teaching parenting. Whoever thought that you should learn how to parent from your own parents, whether good, bad, or indifferent. We really need to educate children about citizenship, being in a family, and how to be a caregiver and parent. Secondary prevention to prevent retaliation. Many programs across the country are now intervening with victims of gun violence with the idea that if they intervene, treat, prevent traumatic stress symptomatology, do a kind of wraparound kind of approach, that they can prevent retaliation. And retaliation is really one of the major forces in gun violence and deaths. And then, we need to support our families better, right? We don't do any of this really in our country, financially. Most countries, there's visiting programs for new families. And again, this is what we have to do much better job of if we're going to prevent, this gun violence phenomena and, frankly, a crisis right now in the country. Next slide, please. These are my citations. Do with them what you want. And I will now turn this over to Dr. Simpson, who's going to be talking about firearm violence in the queer community. Thank you. Oh, and by the way, I have to jump off in a few minutes. I have a prior appointment.
Right, thank you. So I'm going to focus on just some general with suicide and homicide and just violence in general with youth. But also a strong focus is going to be towards the queer community or LGBTQIA+. There's a lot more acronyms coming out these days. Okay, next slide. I have no disclosures to make. All right, so I know we can't interact, but maybe instead of naming them, let's just think about some of the most deadly school shootings that we can just come to mind. I'll give you a couple seconds to think about those. Try to count them. All right, next slide. So we really can't fail to mention school shootings when we're talking about violence in our youth. It is all over the media. It's happening far more frequently, it seems, these days. And the New York Times put out this picture here, schematic drawing out kind of how many there have been since 1970, which these numbers here completely exclude the gunmen who died in the attacks. But they got this information from the K through 12 school shooting database. So here we have 12 of the most deadly since 1970. And all of these, if you pay attention, have really been since 1989. So we're seeing it much more frequently. And I personally had forgotten or even not known about 8 out of these 12. So what does that mean? I think we can go to the next slide, but I think this really highlights how desensitized to trauma that we're becoming. And that's not uncommon with repeated traumas. So it's almost as if society's unintentionally normalizing this. Next slide. So compared to other developed nations, just being in the US, you're 25 times more likely to die by murder from a firearm. That's huge. A common assumption, I think, has to do with people will say things like it's related to mental illness. And we know that's not entirely true. So just looking at this, like our lifetime prevalence of major mental illnesses meeting criteria for a disorder in adults is, we'll just have statistics for adults here, but 46%, and then 9% meeting criteria for a personality disorder. Despite mental health disorders being fairly prevalent in the population, less than 2% meet criteria for severe and persistent mental illness. And what our studies have shown, so from Gleed and Frank did a study, and they talked about a relationship between the severe forms of mental illness and the more typical acts of violence that can be kind of captured in surveys, which is going to be more limited. But it was really strongest among that part of the population, that 2% meeting severe and persistent mental illness. So the other thing they point out is that adults who had childhood conduct disorder, those patients showed an increased likelihood to be violent. Next slide. So most of that 2% of severe mental illness do not progress to violent acts. So patients, in fact, of severe persistent mental illness are going to be far more likely to be victims of violent crimes. Okay, next slide. So let's look at risk factors. So AACAP has their violent behavior in children and adolescents posted on their website. So I got it directly from our own website. So our risk factors of violence in youth is going to be previous aggressive or violent behavior. That's number one. But victims of abuse, exposures to violence in the home, community, victims of bullying, looking at genetic and hereditary factors can be significant. Exposures to violence in the media, it's a lot of people question it, but we do see a trend. Alcohol or drug abuse, firearms in the home, combination of many stressful family socioeconomic factors, poverty, severe deprivation, marriages or relationships breaking up, single parenting, all have shown, and traumatic brain injuries have all shown that these can be some higher risk factors. So we can go to the next slide. So I think one of the important things to point out are, what are our warning signs? So we know our risks. What do we really want to watch out for as well? So increase in anger, frequent loss of the temper, being extremely irritable, impulsive, even those combined, and then becoming easily frustrated. We see this with a lot of our youth and adolescents these days. And I don't personally think that most of my patients are going to become violent. But I think these are just some important things to keep in mind when we're working with patients and families. Next slide. Okay, so suicide and firearms. So we can go ahead and go to the next slide. So twice well, suicide is the second leading cause of death among youth and young adults. And 61% of suicides are by firearms. And this accounts for 3 out of 5 firearm deaths in the US. So this is twice the proportion, or double, compared to homicides. So oftentimes we'll talk about suicides or talk about gun violence and homicides, but really it seems like statistically suicides are going to be a much higher risk there. And we know that firearms are going to be a much more lethal means of suicide. So 85% of the time, it's going to result in death. And research continues to show the relationship between the presence of firearms in the home and that increased risk of suicide by firearm. Next slide. So the CDC indicates that 2/3 of firearm deaths in the US are suicides, and firearms carry that greater fatality rate. Next slide. And among suicides, many believe that the most tragic are those by our youth. So how are they getting access to these guns? Kind of is the question that comes into mind. And a study showed that youths 18 years old and younger, 79% of them used a firearm belonging to a family member, and 19% of them, it was their own firearm. And we can't just think of homicides and suicides when we're talking about gun violence. We have to also highlight the unintentional shootings that do occur. And that's going to be much more common in our much younger youth. So in this study, they did a CDC and then the Johns Hopkins data showed that over 500 people are killed and thousands more injured every year by accidents. And what they found is easy access to these unsecured firearms is increasing the risk. Children are often impacted by this just by gaining access within their own home. And every 6 days, a child under 10 is killed by unintentional shooting. And this was from a study from a 3-year study from 2019 to 2021. But it's important to point out that correlation doesn't always mean causation. So we just have to remember it increases the odds. So keep it in mind. Ways in which we can implement gun safety are really where we need to focus. Okay, so gun violence impacts some of the most marginalized communities. And one of those is going to be, that I'm going to talk about, is the LGBT community. And how really it negatively impacts us or them. Next slide. So suicidal ideation prevalence based on just sexual orientation is pretty high. It's driven by stigma, prejudice, a lot of our social factors. So the CDC's Youth Risk Behavior Survey from 2017 found that over 47% of gay, lesbian, and bisexual identifying students and 31.8% of heterosexual identifying students had seriously considered suicide in that previous year. So this here is from the Williams Institute, and on their website with the gun violence against sexual and gender minorities in the US study from April of 2019. It points out just kind of the percentages of suicide attempts within a year period. 5.4% of those studied identified as heterosexual, and 23% identified as LGBT, so lesbian, gay, bisexual, and 14.3% just weren't sure. Next slide. So the trend of an increase in suicidal ideations in sexual and gender minority persons and the high incidence and lethality of using firearms is real. So this is particularly concerning for our transgender community, and the LGBTQ plus youth, with 40% of transgender people and 1/3 of LGBT youth reporting suicidal thoughts. So suicide attempts are highly prevalent among transgender youth, with one recent study finding over 34% of transgender youth had attempted suicide in the past year, compared to 9.1% of cisgender girls and 5.5% of cisgender boys. So when we look at school violence data, sexual and gender minority students are more likely to be threatened with a weapon. Mixed studies showing some sexual minority students bringing weapons, including firearms, to the schools. And it's presumed to be for self-protection. But there's very limited data specifically focusing on LGBT people using firearms or acting as perpetrators in the community, especially when we're looking at data with youth, because a lot of people we don't screen for it very well, and including any of that demographic, but we just don't do enough studies, I think. Okay, next slide. Domestic violence in the community, including in our youth. So intimate partner violence poses another significant threat. There's even greater threat towards our trans population, including trans youth. And according to FBI, 50 women are shot to death by intimate partners each month in the US. And then over half of our transgender respondents in studies in a 2015 survey had experienced some form of intimate partner violence. We can go to the next slide. Over 90% of murders, there's a 90% increase in murders against trans people over the last 4 years. 75% of those were from firearms. And really, the majority in our trans population have been targeted towards Black women. So yeah, that's another very marginalized community here. Next slide. So this is, I'm towards the end. So just want to point out that gun violence has been in the media. It's affected our adults. It's affecting our youth, also of the LGBT community. So this is just showing the numbers and victims of 2 prominent shootings that have occurred in recent years. So this one is of the Pulse nightclub in Orlando, Florida. And this one is the Club Q in Colorado Springs. So we have to be careful, not just with gun violence, but with normalizing trauma. It's really a bad idea. We have to also be mindful of how we even address talking with patients of trauma. So don't say the things like, you're okay, everything's back to normal. People growing up in these communities, normal's not okay, normal's not safe. Normalizing trauma really just, and gun violence just normalizes the hypervigilance and distrust within those communities. And it really leads to that presumptively justified preemptive violence. So people just reacting. So remember, hurt people are the ones that hurt people. And we want to really question on the ease of access to firearms. Right, so Thank you. I am going to turn it over to Dr. Randawa.
All right, great. Thanks, Dr. Simmons. Appreciate the transition. So I'm Dr. Randawa. I'm going to be speaking about urban gun violence and systemic disparities in BIPOC youth. I'm based in Chicago. I work as a medical director of a inpatient psychiatric adolescent unit, so often see youth of all types coming through that have either been involved with some type of gun violence or have family members that have been victims of it. So this is a common trend and actually an unfortunate pattern that we're seeing in the inpatient setting and outpatient setting. So I do not have any disclosures to report. Slide. And over our time, hoping to further address the crisis in urban settings and also the risk factors associated with it, try to connect the interconnection between disparities and how that perpetuates violence, along with understanding the clinical connection. What can we do when it comes to risk assessments and how to properly do that while differentiating those that may not really be a threat, but might be making threatening gestures to fit in or that is influenced by social influences. Also, prevention strategies and having some opportunity to talk about legal and policy context and how you could get more involved on making a change. Slide. So in urban areas, just to get everybody on the same page, so what's different about it? Why is it important? So as we all know, urban areas bring in many more people. So if you have many more people, the population is going to rise, but those people are not going to have the same backgrounds. They're not going to have the same cultural backgrounds either. And when you have a variety of more people in a smaller place, or let's say a city, then what ends up happening is you're going to have different ways to cope, different influences on how you deal with anger, with frustration. Do you let things go? Do you not? You're going to have different, different levels of resilience that's modeled from your family, different levels of frustration tolerance that can be modeled from your family and other members. But what ends up happening with that combination of variables is that the way you react will lead to different dynamics of reaction. So therefore, different dynamics of violence occur in the urban setting. So with more people, with more of all of what I just mentioned, leads to different contexts perpetuating anger or violence and the need to do something about it. And the contexts in urban settings can also include poverty, which is a perpetuating factor, a predisposing factor at times. Gang activity is also heightened in urban settings, which also will lead to more types of violence, and including with that element when there's going to be limited resources to do something about it or get the help that's needed in order to correct or fix things. Slide. So with that, what is at the interconnection of urban gun violence and disparities? With that, we just can go to just the BIPOC types of facts on what's different, what's happening. So in urban settings with BIPOC youth or BIPOC, so just for clarity, that's Black, Indigenous, and people of color. There are higher rates of gun violence compared to other demographic groups, and it's significant. More importantly, young Black males are particularly at high risk. In BIPOC youth typically receive disproportionate attention regarding gun violence. There's usually more scrutiny and policing compared to Caucasian communities. Other factors, lower socioeconomic status can lead to fewer opportunities to be involved with things after school or types of sports or other extracurricular activities, ways to keep youth busy, let alone getting resources if they need help. And there's also going to be factors such as systemic biases and historical factors that can lead to, or there should be an understanding of what historical factors can and have been an underlying issue leading to more impact in BIPOC youth. So that takes us just for a historical narrative. Next slide. Understanding the significance of redlining. And for those that are not familiar, redlining is as simple as the term. So between the 30s and 40s, there was a discriminatory practice done by banks where they would basically cherry pick or limit or refuse financial help to undesirable inhabitants. And who were those that they didn't desire to give money to? Predominantly minorities or Black, Indigenous, people of color. And so that impact in the 30s through the 60s really was profound and led to significant issues in urban development and wealth disparities. And the goal, unfortunately, of these banks was to have these economic disparities that would continue until they had to be stopped. But the impact of it, again, is very significant because that led to the perpetuation of poverty, perpetuation of limited resources, and then that also impacted generation to generation. So next slide. With that, now we have these types of ongoing stats where there's high risk of being a victim of gun homicide if you're a young African American. To what degree? Well, ages 15 to 29, 18 times likely to be a victim compared to a Caucasian counterpart. Young Hispanics, a 4 times higher rate compared to Caucasian counterparts, and just rough stats that are, again, I wish much lower in number, but 17 young people murdered with a gun each day, give or take, probably more. Being in Chicago, sometimes we don't hear about it till later on, or it will create the stats. Well, we won't hear the stats that are currently happening might not be the stats that we would discuss because it takes some time for that to get to the mainstream. But along with that, more than half, 50% of teenagers have a fear of school shootings. I mean, once upon a time, I don't think there was much fear, maybe tornadoes because we learned those drills, but now there's students that I'll often even see in the inpatient, more often in the outpatient setting, that are stressed because they have to learn what to do if a school shooter comes into their school, which is unfortunate, but also leads to its own dynamic and stress. Next slide. So the impact is real. 25%. Think about that. 1 in 4 inner city youth across America are exposed to violence in their lifetime. And that has its own impact where it's going to lead to its own stress, like we've been discussing, its own psychological dysfunction. And if nothing is done with it, or if they have an influence saying, go ahead and do something about it, it'll lead to either some type of retaliation or vindictiveness, which then would perpetuate more anger or wanting to do something with it, and negative behavioral outcomes. And so if any one of those 3 are occurring and now you have limited resources to do something about it or get help, then nothing gets done and the patterns continue. Next slide. So I know, again, where you don't have the ability to engage, but here just getting to ask yourself, true or false, as a result of the prevalence of gun violence in the US, there is a 50.9% chance that a person's social network contains a victim of gun violence. Take a second to think about this. Just going back to that, it is false. The number is actually closer to 99% of your social circle having somebody that's been a victim of gun violence. For those that know me or don't know me, I can state that I am one of those. I can say that I've been a victim of gun violence, but sometimes it's not discussed or really warranted to discuss, but it's a significant stat nonetheless. So on the clinical side, what I really want to kind of bring home is, what is the typical violent profile? If you take a moment and think about this, what comes to mind? Is the first person that comes to mind have any color on their skin? Do they look a certain way? Do they act a certain way? Do they have any type of significant background issue? Right. And this is just you asking yourself. And what I'm getting at is, we have to understand our own biases when it comes to just what is a typical profile. But in reality, there is not a singular profile. There's risk factors. Yes. It's not a 1 + 1 where it's always going to occur, but alcohol use. Yeah. Alcohol use can do it. It can disinhibit us. It can engage. It can make us do what we otherwise were controlling, make us more impulsive. Police arrest, obviously, any legal issues can occur. And now if you are, lower socioeconomic status and or there's poverty and you've had an arrest and your neighborhood is getting extra policing, then that can also be the perfect storm for, well, I don't like the law, so I'm going to do something about it and engage with some type of gun violence or worse. And so other risk factors, domestic violence, as we've been mentioning, whether you've been a direct victim or you've observed it, can definitely influence your own reactivity. A gang in the area, whether it's in the school, whether it's in the neighborhood, or locally, can be a significant issue. And also any recent triggers, altercation, any serious fights, any type of significant cyberbullying or anything in that realm, it can easily cause some type of, I need to do something about it. And I'll often see kids that are admitted because they had made a plan to go and harm, or they actually fulfilled, going back to harm someone with a threat of buying a weapon, getting a weapon, or knowing somebody that had a weapon to do something about it. So friends definitely do influence friends, but again, really take home message is that there is not a typical violent profile, but all the more reason we want to be good at probing and understanding which one is which. So next slide. So impact of victimization, just to further take this, direct victimization, you've witnessed the event. So if you've witnessed the event, you've logged it in, this is gonna be a greater predictor of offending. Correlations between victimization and delinquency have been statistically significant, as we were discussing earlier. Indirect victimization associating with peers who have been victims themselves, they can influence each other, and peer victimization. So higher the age, higher the peer influence towards delinquency. Next slide. So risk assessments, gun behavior. What is our typical go-to question? Access. Do you have gun? Do you have access to a gun? And more often than not, when I see a kid admitted, that's the extent of what's been probed. And then they are admitted because they made a threat and said, yes, I could maybe get a gun. However, you also want to pay attention to what is their behavior like, because gun carrying behavior or severe externalizer as anger reaction is the biggest part of it. Is this person a fighter? That's also someone that's going to be more willing to demonstrate their strength, and also substance abuse. Familiarity also matters, right? So what's the language of their gun narrative? What kind of type, what kind of brand, what kind of model, what kind of ammo do they use? These are questions you want to probe and ask if you find a youth coming through your setting and they're saying they're going to get a gun and do something about it. Meaning, the goal there is to understand how much effort have they put into understanding the gun they would get, or do they just loosely say, I want to get a gun, right? And if they are, then what's their motive? Is there retaliation? Is it intimidation? Is it protection? Is it fitting in? And unfortunately, I've been seeing more and more kids trying to fit in by talking guns in certain social situations. And also, do they have any concern for consequences? Right, next slide. So the differential, just to keep in mind, anyone can say anything about a gun at any time, right? And whether you had road rage as an adult, sometimes we say things off the cuff. So I say that because slang and culture matter. Urban slang associated with guns could be influenced by music, social media. I'll be strapped, or they'll make a variety of different statements. But what I'm getting at is the wrong audience will often equal wrong response and attention. So you can easily say something, but you want to differentiate, am I just making an empty threat, or am I doing something more about it? Because not all statements or gestures signify real threats. And so if you are in that position to do a risk assessment, make sure to really clarify that so you can alleviate a family, their friends, or the school's concerns when it comes to somebody maybe being a threat. So you really want to understand where they're coming from and why youth may have said what they said. Next slide. So risk assessments, do yourself a solid if you don't feel comfortable, be adequately trained and get familiar with it. Understand developmental level for any youth that is making a threat or something more intense. Be aware of be aware of any countertransference and transference issues and your own biases when doing a risk assessment. And avoid pitfalls, right? Mislabeling someone as violent if you have very little information or very little to go on. And because in itself, there can be a significant short and long-term negative impact of it. And it can also lead to improper treatment, medication, and prognosis if it's not adequately done. Next slide. So prevention takes effort. We can all keep trying our best, but it can be at every level: community-based interventions, investment in education and youth programs, enhanced gun control measures, addressing economic disparities, and providing adequate mental health services if and when possible. Next slide. So, and then piggybacking off the prevention piece, obviously takes more action. So if you get the chance, try to support your local violence prevention and intervention programs, be aware of them, because you can also offer this education to families and have them be more engaged. You can support youth jobs programs, implement trauma-informed education programs, which we need more of, smart on crime approaches to criminal justice, and when possible, get to know what's going on at the CDC level to support any research gun violence as a public health issue. Unfortunately, we could keep on researching and almost know all the impacts, but again, something needs to be done, as we all know. Next slide. So that concludes my end. Appreciate your time today on this Saturday, and I will now turn it over to Dr. Shrestha.
Thank you, Dr. Randhawa. I am Selena Shrestha. I am an assistant professor at the Southern Illinois University School of Medicine. And my topic today is kind of twofold. I'll be first talking about the rural gun violence, and then I will be talking also about the gun legislation in the United States. I do not have any relevant disclosures to make today. So I practice in Springfield, Illinois, which is certainly not a rural area, but we do serve significant number of people coming from rural counties, which is kind of a norm, since rural areas are far from urban centers and people typically have to travel several hours to see specialists or subspecialists. There aren't any higher level trauma centers close by. So often with when youth with gunshot injuries in rural areas, they usually have to be transported to hospitals far from their hometown. And it may be very well that in these hospitals, these youth come in contact for the first time with a child psychiatrist, such as myself and many others who are probably watching, who are practicing in the CL setting. And this may be the first opportunity for us to kind of intervene and provide education on gun safety and mental health to these youth as well. Next slide, please. So as I said, health disparities in rural youth, it's something that most of us are very aware of. What we may not be thinking much about is also the vastness of gun culture, and gun culture is no longer considered to be one or monolithic, but rather it can be very diverse. Guns can mean or have various meanings to different individuals, and also communities or families. For some, it may mean power, freedom, or for some others, it may mean responsibility or morality. It may just mean ways of life. So there may be different levels of these virtues within a family or a society. Understanding these values are important if we want to educate, our patients or families on gun safety. I learned this the hard way. Several years ago, our CL team evaluated a 14-year-old boy who was transported from an outlying hospital with a self-inflicted gun injury to his stomach. After we spoke to the child, we started to speak to the family about gun safety. Immediately, the family got very defensive and the conversation did not go anywhere. It was only later that we found out that the family had very strong and different perspective on gun than most other families that I usually treat. So reflecting back, had I known about the differences in gun culture then, I would have approached the situation differently, and I may have had a chance to kind of initiate those crucial conversations. We all know that it is important to kind of meet our patients and families and communities where they are at in order to make any change. So we need to know what we don't know and kind of educate ourselves to potentially avoid any biases that we may have, which I've been doing since that encounter I had with that family. So yeah, most people believe that youth gun violence is an urban problem, which is actually not true. Rural areas are equally burdened by this problem. Here, you're actually looking at the firearm deaths in youth ages 1 to 24 in 2021, which is the latest CDC numbers in their website, showing the total death per capita in rural and metro areas is actually very comparable, 10.6. What is different is that you can actually click next, please, thanks, is that there are higher rates of firearm suicide in the and unintentional death due to firearm in rural counties as compared to the urban areas, like you can see in this graph. So this graph shows you the trends of firearm death in the United States in youth of the same age, which has been rising over the past 10 years, and it has reached the highest in 2021, that both for suicide as well as homicide. Next, please. And over the past 10 years, use of firearms in homicides in rural youth has been increasing, reaching to more than 75% in the age group, and more than 50% of all suicides in rural youth actually used firearms, which seem to be higher than in metro youth. Next, please. So this is the same data kind of separated per age group. And I just want to kind of draw your attention towards the left lower graph and the teal bar showing suicide in rural youth ages 10 to 14 years, and compare it to the lower right one, same age group, showing how suicide due to firearms in this age group has increased by over 4 times over the 10 years, which is very striking and sad. Next, please. So there can be social, cultural, and ecological differences in people living in rural areas, like rural youth are more likely to use firearm for sports and recreational purposes, and they're also more likely to be exposed to firearms at an early age, and the average is 12 years. Firearm ownership is more common in rural areas, and there is greater household access to firearms. That being said, experience with formal training and regarding firearm use and safety is also more common in this age group, in this youth. So rural youth may be at higher risk of firearm-related mortality, not just because they have higher access and exposure to firearm at a younger age, as well as higher health consequences due to disparities that we talked about. There is limited mental health access or treatment in their area, and also limited access to trauma centers, which may mean that if a youth gets shot in a rural area, chances are the shot is going to be lethal for them and have higher consequences due to that. Next, please. So the data we just examined actually includes just the deaths due to firearm. The bigger part of the gun violence iceberg is rather understudied. We don't even have much, research on the immediate effects, like the physical injury or psychological trauma due to gun violence, let alone other lasting effects and multi-generational effects. So we do need a lot of research in this area to kind of understand what's going on and the consequences to be able to kind of create preventative measures. Next, please. So where does the United States stand in gun deaths compared to other high-income countries in the world? So it appears that this kind of firearm problem is very unique to the United States. So an article published in 2015 here shows that 92% of all firearm-related deaths of 5 to 14-year-old occurred in the United States. 96.7% of all children aged 0 to 4 killed by guns were from the United States, and firearm homicide rate among 15 to 24-year-olds in the United States was 31.1 times higher as compared to other high-income countries of the world. Next, please. So what is the solution to this huge problem here in the United States? As the famous inventor Charles Kettering once said, a problem well stated is a problem half solved. So do we have our problem well understood? The answer is actually not yet. So why do we lag behind the understanding of this problem here in this country? Next, please. So part of the reason for this may be because of not having enough research on the topic and the impact how everything kind of unfolded. So to kind of learn this, I will take you to the relevant years on research in gun violence. So in the 1980s, CDC adopted a public health approach to gun violence with intention to define and understand the problem. So CDC funded some research, and in the 90s, articles were being published with information which showed that just having the presence of firearms in the home was strongly and independently associated with significant increase in risk of homicide as well as suicide. This information did not sit well with some of the political organizations, and lawmakers actually accused CDC of being biased against gun. So as a result, in 1996, an amendment called the Decay Amendment was added to the United States spending bill, which prohibited use of federal funds to promote advocacy and control of firearms in the United States. This actually eliminated the funding provided by CDC for research in this area. Several years later, in 2011, the same amendment was extended to NIH as well, as articles such as one showing link between gun possession and assault was actually being published with NIH funds or NIH funding. So year after that, people probably remember tragic shootings at the Sandy Hook Elementary School occurred, which led to very heightened public outcry. And there were creation of very strong advocacy groups following that. New gun violence task force was created by President Obama at that time. And many states started to have required universal background checks. And also the president also urged researchers to do more research to study this topic. But it was not until the tragedy, another big tragedy in 2018, the shooting at Marjorie Stoneman High School, which many of you remember as Parkland shooting, that there was a written clarification on the bill. So the written clarification allowed the CDC and NIH to allocate funds for gun violence and prevention and its research in 2019. And this was during the President Trump's term. So by 2020, there has been several projects to kind of, projects funded to start the research on this matter. And last year in 2023, there was first ever White House Office of Gun Violence Prevention, which has been established. So although we seem to kind of lose like 40 plus years of potential research time, we now seem to be on track for the research, and we should know more about, what would be effective preventative strategies in future years. in my opinion. Next, please. So what evidence do we have for our existing laws to show that it reduces firearm violence, keeping in mind that the research is actually very new in this area? So what we know so far is laws designated to regulate who has firearms are shown to be more effective than laws regulating what types of guns are permitted. States with gun laws requiring universal background checks for all gun sales were shown to have homicide rates 15% lower than states without such laws. It does seem like not every law seemed to work the same in urban and rural population. For example, background checks were found to be even more effective in large cities, whereas violent misdemeanor laws were found to be more effective in preventing homicide in rural and suburban areas. Next, please. So universal background checks, these extend farther than the required federal law background checks, which may have some loopholes. For example, guns purchased through gun shows, internet, and private transactions, they may not be required to go through the similar, background checks. Universal background checks would require all firearm transactions to go through the national background check system. As of last month, 21 states in the United States have extended checks, and 16 have universal background checks. There are states, including Illinois, which require permits for gun ownership, and such requirements are shown to be associated with lower homicide rates, both in urban as well as rural areas. Next, please. Extreme risk protection order laws, or ERPO laws, are actually based on domestic violence protection order laws, which are well-established tool for protection of intimate partner violence. Such laws would allow various members of communities, such as law enforcement, medical professionals, partners, or families, to flag someone who may be of danger to self or others. And this would allow the courts to temporarily prohibit that individual from possessing a firearm. So this kind of laws varies by state. For example, in Illinois, short-term firearm restraining orders can last up to 14 days, and long-term can last up to 6 months to a year. So these are different per state, and the details can be different per state. Actually, there is a website called erpo.org, and you can check whether or not your state has this law and the details of what exactly your state law entails in your state. Child access prevention laws, or CAP laws, are geared towards preventing injury or death due to firearm. And these kind of laws are actually associated with 13.1% reduction in adolescent firearm suicide and 17% reduction in firearm homicide committed by juveniles. So as of last month, 26 states and District of Columbia have CAP laws. Next, please. Violent misdemeanor laws are designed to cover what federal law may not. So basically, federal law prevents people with felony convictions and domestic violence, even if it's a misdemeanor, from acquiring firearm. And this law would cover any misdemeanors and not just domestic violence. Violent misdemeanor laws are associated with 18% reduction in homicide rates, and 15 states have adopted this law since as of last month. So there are other policies which may help as listed here, that I have listed here. but we do not have any published data to prove this yet. I do want to highlight the state victims' access to justice law here, which is newest of all, and this was first enacted in the state of California in 2022, followed by 7 other states, including Illinois. And this law allows victims of gun violence to fight gun industry immunity law called PLACA, or Protection of Lawful Commerce in Arms Act. Next, please. So in summary, gun violence in youth in the United States is rising. More inclusive research is needed to understand this crisis, which will lead to development of effective solutions. By inclusion, I also mean that we do need to kind of look into rural population as well, where the presentation might be a little bit different. Research and policies on firearm prevention is nuanced and dynamic, and clinicians should be aware of the changes. And we all should take part in advocacy and education to help fight gun violence and to build safer communities. With that, I would like to invite Dr. Fritz with his presentation. Thank you, everybody.
Thank you. It's a pleasure for me to be a part of this panel, and my discussion is I've titled it Guns 101 for Gun Control Advocates. And next slide goes to my disclosures. I don't have any financial or other relationships that are in conflict, but I want to disclose that I'm an avid bird hunter, have been all my life, and also a gun owner. And I'm pictured there with one of my shotguns and my most recent dog out in South Dakota. Next slide. So this is somewhat of an unusual talk. The rationale for it is just my experience over the years that it seems to me that too often urban professionals, of which many child psychiatrists are included, are strong gun control advocates, but tend to have little or no knowledge or actual personal experience with guns. And this is problematic in the advocacy realm for several reasons. And before we mention what they are, I'll jump to the conclusion of this talk that this can be easily remedied, and we'll have that as a last slide. But next slide. The question is, why should gun control advocates know something about guns? Several reasons. First of all, obvious ignorance about guns undermines our efficacy of advocating for more reasonable gun policies. Gun owners tend to write off suggestions of the uninformed, people that they think don't know anything and aren't really very interested. They just don't pay attention to what they are arguing for. It also can lead to polarization if gun control advocates have mistaken assumptions about what is going on, and it can really polarize them from the gun owning community. So, and gun owners, gotta go back to that. The gun owners are critical to any change regarding the use of or possession of guns, for the obvious reason that they have the guns now. There was a joke about Willie Sutton, a famous bank robber of a few decades ago, who was asked, "Why do you rob banks?" And he said, "Well, that's where the money is." And then it's a parallel situation to gun owners are the ones that have the guns. So that advocates, we can't just write off gun owners as nuts or people that we don't respect. We have to engage them really to be effective at changing the way the gun culture that we've heard described. Next slide. And then as child psychiatrists, we have additional reason to know something about guns because part of our job is when we're evaluating suicidal patients and their families, we have to have direct conversation about guns and access and safety and that sort of thing. And it's my experience that when it's human nature that when we feel like we don't know anything about or don't know as much as we maybe should know about a topic, that we're uncomfortable and we tend to avoid it, those sorts of conversations, and that they become, instead of really thorough and probing discussions with patients or families, they can be superficial discussions and just checking boxes, etc. So my belief is that if we have at least a basic understanding about some of the details associated with firearms, we'll be more effective in having these conversations. So next slide. As far as I know, this is an AACAP first to have a assessment of basic gun knowledge as part of a symposium. And we did this in our presentation on this topic at the past AACAP meeting last October. And it was more of a participatory thing. We had people with the live situation, they raised their hands and so forth, but so we can't quite do that as readily on this virtual presentation. But so I would urge you to get a little piece of paper, and I'm going to give you 9 questions, and before we get the answers, I want people to make a note of what they think the answer is, and then see at the end of the few minutes of this presentation, we'll see how well everybody has done. And of course, it'll be kept to yourself in this situation. So a couple rules: answer promptly, no Googling or using your cell phone to find out the answer quickly, and no abstaining. Put down what you think the answer is, and maybe you'll guess it right, or maybe you'll be surprised. Anyhow, with that, let's get going with a few of these questions. Question number 1. Approximately what % of gun owners belong to the NRA? I've listed 3 possibilities: 65%, 25%, or 5%. Which do you think is closest to the actual number? All right, with that written down, the answer is C, 5%. How do we get to that? Well, the estimated number of gun owners in the United States is about 100 million. And the NRA claims about 5 million members. Although I should note that that number is declining every year due to the various problems and dissatisfactions with the NRA. But 5 out of 100 is 5%. So the point being there that in case you didn't judge that it was only 5%, it's important not to assume that the NRA speaks for all gun owners. Many gun owners, myself included, resent the NRA and think it's a very problematic organization. Next slide. So this is true or false, and it pertains to assault rifles. Assault rifles are, by definition, military-grade automatic weapons that are more lethal than regular or civilian guns because their rapidity of fire. Is that true or false? And the answer is that it's false. Assault rifles are legally only semi-automatic. There are no automatic weapons in civilian hands legally in the United States. The difference is important. Semi-automatic means that you have to pull the trigger once for each shot, whereas an automatic weapon, you pull the trigger once and the gun fires until the ammunition is exhausted or the trigger is released. And the they're both can be quite rapid shooting, but the automatic is just a spray of bullets that is, if there's a large magazine, it can shoot hundreds of bullets in a very, very short time. And there are also bolt action or pump guns that are, those refer to different mechanisms for ejecting a spent shell and replacing it with a live shell ready to shoot. And the bolt action or pump guns are much slower than either semi-automatic or automatic. But the important point is that there is a big difference between semi-automatic and automatic, and there are no automatic weapons legally sold or possessed in the United States. Next question. Or this is in, excuse me, the next slide shows the difference in appearance. The assault weapon is in the upper left-hand corner, and as you can see, it's a very different and much more military and tactical and macho and horrible looking weapon than the other the pump gun beneath it, or the bolt action rifle that's shown in the lower right hand corner. And so I think that and it's not only I, many people have found that when assault weapons are used in mass shootings, the perpetrator is drawn to them by the appearance and the potency that the black color and the trigger, the pistol grip and the cooling apparatus around the barrel and the magazine, etc. That's what defines an assault rifle. And even though it doesn't make it much of a difference ballistically in civilian assault rifle style weapons, it makes a big difference to the person who's buying a weapon and wanting to be powerful and kill as many people as possible. It's the appearance that makes the difference. Next slide. Question number 3 pertains to the ammunition, and is whether this statement is true or false. The ammunition that is commonly used in assault-style weapons at mass shootings is uniquely lethal, meaning higher velocity, more destructive on impact, more powerful than normal ammunition. True or false? Next slide. Answer. Basically, the answer is that assault-style weapons that are legally available in the United States are use exactly the same ammunition as civilian rifles. And sometimes they have interchangeable barrels that allow the use of multiple different calibers, etc. So that's false to number 3. Number 4 question. What's the difference between a rifle and a shotgun? It's 3 possibilities. A shotgun always shoots multiple pellets with each shot, while a rifle shoots a single bullet. B, a shotgun barrel is smooth, while the rifle barrel has a spiral groove. Or C, a shotgun is used only to hunt birds. Rifles are used to hunt mammals of different sizes. Which do you think is the correct fundamental difference? Okay, the answer to question 4 is B, whether or not the barrel is smooth inside or has a spiral groove and cut into the barrel. The spiral groove it gives the projectile, the bullet, a spiraling or flight, just like a Tom Brady pass, that it makes it more accurate at long distances and much more controllable. Shotguns with smooth barrels can shoot either a single projectile or a pattern of many small pellets, but without rifling caused by the spiral groove, they tumble in flight and lose their energy very quickly. So a shotgun is extremely lethal at close range, but not to a half mile or or more that many rifles are accurate. Next question is another true or false. High capacity magazines are readily available and legal in most states. These clips allow 30 or more rounds to be fired in rapid succession in most rifles. True or false? And the answer is true. High capacity magazines are widely available and they have no reasonable civilian use. Banning them should be a no-brainer. There was a law passed on the federal law that banned assault rifles and high capacity magazines, and was passed in 1994, was allowed to sunset in 2004, and it has not been re-upped since. So the situation now is that only 13 states have any magazine restrictions at all, and the rest, you can get any size magazine with no problem. And the 13 that do have magazine restrictions have so many loopholes and variabilities and stuff that it's not really very effective. But it should be, in my opinion, the first gun control thing that is nationally passed, because it's so uniquely important in these rapid shootings. Next question, 6. Adolescents' immaturity and impulsiveness is recognized in most states by prohibiting gun ownership by those under 18 years of age. Do you think this is true or false? The answer is false. In most states, adolescents can own any long gun as long as it is gifted to them by parents. They generally can't go to a gun store and buy them, but they can own them if it's been a gift. Adolescents can also readily make guns from kits that they can get on the internet or TikTok videos showing the details of construction for ghost guns. Now, owning these kinds of guns is illegal, but extremely difficult to police. So, and when you add in guns that are stolen and are sold in that market, it's basically quite easy for an adolescent who wants to own a gun to get one and keep it. Question number 7, true or false here. Most pistols are semi-automatic and can shoot 13 to 14 rounds as fast as you can pull the trigger. The answer? That's true. And where the high capacity magazine is in the handle, as you can see in the pistol and the picture. So those are easily replaced, and they hold 13 to 14 to 15 bullets. Glock, which is a maker of many different handguns and rifles, sells a small part. It's called the sear, that if you know what you're doing, that you can easily transform a semi-automatic pistol like the one pictured into fully automatic. So you pull the trigger and it will empty the magazine entirely and with one trigger pull. And that's especially problematic because pistols are, compared to long guns, are much harder to control. They really keep them accurately aimed for multiple shots is nearly impossible. All right, question number 8. This is true or false also. Firearms safety classes are key to reducing gun deaths, but are not now required. I guess there are 2 questions here, but let's go to the answer. That's basically false. Although many police and legislators and gun advocates think this is true, believing that such classes will reduce gun accidents. And in fact, I think everybody agrees that gun safety, it's important to know something about the use of guns and so forth if you're going to have one. But then what happens is that in these classes, it's been that people have gone to them and studied what actually is taught. And though all these classes do teach gun safety, but the most time is spent on discussing other topics such as how vulnerable people are within our society to bad people who want to hurt them, or how crucial guns are as self-defense tools, and how to shoot an attacker effectively. And all of those three when emphasized, are potentially making actually use of guns to quote protect or defend oneself more common rather than less common. So we hear about people that have, somebody pulls into their driveway and they shoot them through the screen door or something. These a sense of vulnerability and the need to use the guns that they have as self-defense tools can be heightened by these classes. So the answer is not the type of classes that we mostly have available now. Last question. $565 million is the bottom line for which of the following? A, the NRA income in 2020. B, the annual budget of the Sierra Club in 2022. Or the total raised by Pheasants Forever's most recent conservation program. What's the answer to that? Next slide. Lo and behold, it's Pheasants Forever, the most successful conservation charity that you've never heard of. They just finished that a year ago and raised quite a large amount of money to put to habitat restoration and environmental conservation. I think many people don't think of pheasant hunters as primarily conservationists, and just for interest sake, the NRA income in 2020 was only $256 million, and the Sierra Club's annual budget in 2023 was $150 million. So Pheasants Forever is a conservation organization bigger than the Sierra Club, and partnering with many other conservation organizations as well. So I put that question in just because I'm an avid Pheasants Forever supporter, but also the fact that there's a lot of things that people don't know about hunters or gun owners that it's probably good to learn about. Which brings me to the last slide, and that's my recommended remediation. I think that if anybody spent a half an hour online with a Google search for firearm basics, we'd be much better off than we are now. I think and it's a requirement, I would say, if we're going to be advocating effectively. So there are a couple of websites that I've mentioned here, and it's easy to find information, and I recommend it for everyone. So thank you for your attention, and now we'll turn the remaining part of the program over to Adrian Adams, and thank you for your attention.
Okay, thanks, Dr. Fritz. So once again, guys, as we're wrapping up, I do invite you to write any questions you might have for the panel in our Q&A part, because we will be able to do a few of the questions towards the end of our presentation. So I like ending with strategies on how to resolve this crisis. And you guys bear with me, I'm a Trekkie, so, and Captain Kirk, I think it's the best captain. So in thinking about that, I don't believe in a no-win scenario. So for me, I feel like if there's a problem, there's always a solution, and we just have to kind of continue to all work on it together in order to resolve it. And I guess, yeah. And I'm gonna probably go back to my Trekkie stuff and say engage each time I change slides. But as far as disclosures go, yeah, I have no financial relationship with any of these. I'm a volunteer for organizations like a lot of us, and so I guess a glutton for punishment. Engage. This is one of my favorite quotes that once I read it, I just kind of fell in love with it, and I feel like it really means a lot to most of us. And I'll read it. Even in dark times, we not only dream, we do. We not only see what has been, we see what can be. We shoot for the moon, and then we plant our flag on it. We are bold, fearless, and ambitious. We are undaunted in our belief that we shall overcome, that we will rise up. This is American aspiration by our Vice President, Dr. Kamala Harris. Engage. Okay, so as my colleagues over the last hour and a half have mentioned, gun sales they've dramatically increased since the pandemic, right? And per a lot of literature that we're reading at this point, there is an association with having easy accessibility to guns within homes as to increased rates of youth suicide, right? So within the United States alone, there's an estimate that there are 37.4 million households that have children. And within those households, 34%, or roughly about 12.7 million of these households, have one or more guns, which cool, but the more concerning part about it is that out of that, 21% of those households store their guns in the least safe manner, meaning that they're loaded and unlocked. And 50% store these guns partially or least safe manner. So either they're loaded, locked, or unloaded, unlocked, but not in the safest manner, which would be either out of the home or locked, unloaded with ammunition locked in a different location. Engage. Okay, so a lot of times they wonder, like, well, so what? What's the bigger concern about this? But if we think about the beliefs of our patients' families, so for a lot of parents, and this is a survey based on a survey, 75% their children 4 to 12 years old will be able to differentiate between a toy gun and a real gun. 25% of the gun-owning parents also believe that their children can be trusted with a loaded gun. Now, this is in comparison to a little bit over half of the non-gun-owning parents believe that their children can also distinguish between toy and real guns. And 14% of the non-gun owning parents feel that they can trust their children with a loaded gun. So meaning if their children happens to come upon their loaded gun, that things will be fine and the kids will not touch them. So if you think about that, out of both parent groups, the 75% of these parents feel that their children would not touch a discovered gun. Engage? This is also coupled with, say, physician, clinician, provider beliefs. A lot of clinicians recognize that there is a problem with having guns that are accessible in our family, our patients' households. However, with that concern, it does not always translate to us providing gun safety education or counseling. And there are a lot of reasons for it, but some of the more common reasons are that we worry about offending parents, coming off like we're trying to lecture to them, Some clinicians feel like, I'm not really sure what to say, or I don't think I have enough knowledge on the issues, so I'll just kind of shy away from it. Sometimes due to pressing time, we might have a lot of patients kind of coming in and out of our office. So maybe they feel like they don't have enough time to really engage in that topic. Or there have been concerns depending on where you're working, which state. Some states in the past have had limitations on how much engagement. Sometimes we feel like our patient population would not really have this issue with guns. And once again, if we think about, there's misconceptions about, urban areas versus rural areas. But as we all realize per our talk, guns are everywhere, right? And I would say even a bigger thing for some of our clinicians, they're not even sure if talking will really help. So they're kind of like, why invest the time? Okay. But with that being said, we realize that these are a lot of myths. These are really things that aren't really factual. They're just based on what we think, but not on the truth. So, in looking at parents as well as patients, they recently did a study and they realized that the majority of both patients and parents feel it's okay for their physicians to ask them about gun safety and even to provide a little gun safety education. And as of 2020, a healthcare provider can talk about guns with their patients and document it. So that's in all 50 states. So those restrictions are not an issue at this point. The thing that I found most especially interesting as far as for exposing the myths is that a lot of times parents feel like their kids will be safe with guns. So, there's no need to even talk about it. But in a study recently done by our Eddie Eagle Gun Safe program, that despite training 90% of boys ages 8 to 12 years old, and this is a program that's advocated by the NRA, 74%, hear me, 74% of them handled this discovered real gun, and 48% even pulled the trigger. So I kind of found that mind-blowing. Okay, engage. So once again, it is a concern and it is a problem, but there are interventions, and that's what I always love about it. So we'll first start with the parental interventions and then we'll go to the clinician interventions. So for parental interventions, just some of what we call protective factors, right? So just keeping their kids enrolled in school, they find continuing education is a protective factor. Monitoring their children's activities, behaviors. So that means being engaged with their lives, encouraging and really motivating their kids to pursue educational goals as well as have future aspirations for their lives. Those are also big things that what we call protective factors. Okay, engage. One of the bigger programs that actually has been studied is called the Asking Saves Kids campaign. And this was actually officially launched back on Mother's Day of 2000. And it was launched on the Million Mom March in DC. And what this campaign is actually proven in various studies that it's one of the most effective messages proven to be effective for interventions for gun safety. So basically with the gun violence prevention message, it's been studied, as I said, by both Harvard University, the US Government Accountability Office, and it's just like several simple questions that parents can actually ask just before having their kids go out to play. So a lot of times when we have our children visiting with the neighbors, they might find out they're like pets for animal allergies or, various things like that. But in that, we should also ask about guns as far as if there's a gun in your home while my child's playing with your child. Are all the guns stored in a locked gun safe? Are guns and ammunition locked separately? And who has the key? They have found that this little intervention has prevented a lot of tragedies. Engage. So as a parent, it's never too early to begin talking about gun safety. And so that's just, I would say, the take-home message that you should definitely tell your families as you're meeting with them. Engage. I have here listed some parental resources or things that we can share with our families. The Understanding Gun Safety, the project Child Safe actually provides trigger locks for guns for free for parents. They sometimes will even come out and do talks. Of course, I have our website, the AACAP website, our Gun Violence Resource Library, as well as the American Academy of Pediatrics has the extensive website on gun safety and education and resources. So I invite you all to check those out. Engage. Okay, but as far as for clinicians, that's kind of getting back to us, like what are things that we can do? So up here is just a copy of a card that the Gun Violence Resource Committee developed, which of course is provided by AACAP. And it's just a way to kind of think about how to implement assessment questions into everyday mental status exams when we're meeting with our patients. So on one side is really a double-sided card. So one side is for the youth and the other side are safety evaluation assessment questions for guardians and parents. Okay, engage. Okay, but for physician interventions, and we'll start more with the individual goals. One of the things that I always like to say is empower yourself. I know, and I'll kind of do a quick personal story as part of the gun violence resource group. I would say several years back, I was really feeling concerned about all the senseless violence that we were seeing. And at times I was feeling a little helpless, like, what can we really do? But I realized that as physicians, child psychiatrists, parents, constituents, there are a lot of things that we can do. And so I would say like-minded individuals within our group, and we have been like really working it out to figure out ways to empower all of our members. So some of the things you can also do is check into your state's laws on firearms and become aware of any pending bills involving firearms. And that, as Dr. Fritz has mentioned, a quick Google search, getting involved, becoming more involved with maybe your regional organization. If you go on the AACAP website, looking at certain committees, task force, and, attending a meeting. Within even your own state, remember that although, there are leaders, our congressional leaders, but still we are the constituents, and so they work for us. And so if we do not like what they're doing, it's our right to contact them via emails, calls, letters, just letting them know about our concerns. Engage. So I have here listed a couple of sites to kind of make the Google search a little bit easier. I would say the Common Cause one is probably one of the pretty neat ones, in that you just put in your name, well, your address with the zip code, and pops up both not only your federal representatives and senator, but also your state representatives, any bills that are happening in your state, whatever laws are, gun safety laws that are currently occurring, all that will pop up just with putting in your address. As Dr. Saresta mentioned, our AACAP organization, that website has a lot of information explaining about the process on how to conduct AACAP. Engage. Okay, so I'm a big fan, and I'm going to totally probably mispronounce his name, but the Bronfenbrenner's ecological theory, that was something I learned a lot during my didactics as a fellow. So I kind of thought about what the interventions of more of a layer system. So the microsystem goals, I would say as an educator, we can begin including didactics regarding gun violence research within our clinical supervision of our trainees. Once again, mandating or requiring more implementation of gun safety assessment questions along with our other safety assessments. Having a grand rounds regarding gun violence research. As a child psychiatrist working in a community, volunteering to provide a talk to schools, going to community groups, sky's the limit. Engage. ecosystem goals. So that if you think about would be the next layer, so that might include becoming that local expert for media communications as firearm and youth interests kind of intersect, kind of making your voice heard, amplifying it more by writing opinion pieces in local newspaper, even inviting your state's congressional leaders to come to your ROCAP meeting. And a lot of times they will do that because they like to be involved within their community. Engage. So this is just a quick slide going over a reminder over, I think Dr. Rendell was talking about systemic disparities. So as we know within the communities, that some communities due to redlining and other issues are underserved. These underserved communities typically might have less engagement, more empty homes, less ownership, and thus a higher risk for illegal activities. But they've shown one of the systemic improvements in a study in Philly back around 2020. They showed just by planting trees, flowers, removing some of the empty windows, actually improving the lights, just those type of local municipalities actually reduced the community violence within that area. So engage. So then that kind of leads you to the macro system's long-term goals, which include things as mentioned by one of our other presenters, tax credits, as well as affordable housing, affordable childcare, livable wages, equitable and well-supported public schools, positive police community engagement. So that means none of the over-policing, but actually having the community and the police work more hand in hand, as well as probably one more return. Yep. Reinvestment in neighborhoods. So the elimination, as I mentioned, of the abandoned homes and the poorly lit streets. Engage. So that concludes our talk, and I believe now we have time for a few questions for our Q&A. So thank you all. And before we go to Q&A, I want to once again thank our AACAP staff for being so wonderful during this process. As always, Alex, Quentin, and the irreplaceable Rob Grant. Thank you. Okay, so Greg. Okay, question for you. Mass shootings always cause much alarm and news coverage, obviously. If I understand the statistics correctly, more gun violence is more individual, suicide is much more common than homicide, and receives less attention in the media, and thus for the public. Is that true?
Yes. Yes, it is. But for some reason, the mass shootings are what draws the media and gets all the attention. But in terms of the impact on Americans, homicide and suicide are infinitely not infinitely, but a much bigger problem. So, and the same thing goes for the weapons themselves. The assault weapons that I had a picture of one of them are used in these mass shootings disproportionately. But in terms of the people that are killed by assault weapons in mass shootings compared to those that are killed by suicide or homicide and more mundane, readily available civilian weapons, there's no comparison. It's a fraction of the number.
Okay, thank you. Okay, this is for Dr. Saresta, I believe. Would it be possible to get content and the mandatory state firearm training for firearm owners on suicide prevention and how to protect those in their household?
Well, I think to have the mandatory firearm training, I mean, it's a great idea, but again, it depends on the laws, whether or not the state will be able to incorporate those laws to get it mandatory in our states. So it really depends. So this is where I think we can all advocate for what would be safest for our community. And what was the second part? How to protect those in their households? Like, well, I think protection, I would assume that how to protect like people who already have guns in their household, how to protect the children in the household. Well, I think that's where the strong child access prevention laws come into play. And it is, again, these laws vary by state. So again, to advocate for more stronger laws that would do that. For instance, in Illinois, Illinois has strong CAP laws, which it is very, I think it is unlawful if unlocked firearm is accessible to minor under age 14 in Illinois. So the consequences are greater. So I mean, I'm sure there are states that have more strong laws to prevent that household injury as well. So that's what I would say. I don't know if other people in the panel would want to add.
Yep. Dr. Randhawa or Dr. Simpson, anything to add?
Sure. The one thing I would mention is I think it's very variable on what exactly is needed, what kind of home they're living in, what kind of access to safety measures they have, and kind of addressing it in that way, and also just understanding from the caregivers or the parents' point of view what they need, what they feel needs to happen, and then helping them facilitate it. So I don't think there's one will fit all type of feeling, but as long as each one is willing to tell you what they have and what the concerns are, then can address it accordingly.
Yeah, and so kind of, I think this piggybacks on one of the other questions that came in by Hefsey. I think if we think of this from a family systems or family dynamic perspective, not just focusing on just access from children, but addressing families and supports. When we know mental health issues, so thinking of suicide in particular, we know of, and trauma, we know mental health issues are oftentimes within families. And when we have even parents that have been involuntarily hospitalized or convicted for violent crimes of some sort or what have you, incorporating laws that take all of that into account when is really going to be another layer of protection that I think we'd have to address. But it's so state dependent. Like for the question for FC, speaking just with here in Hawaii, we have more laws regarding concealed weapons, and to even access those, it's dependent upon the person applying to disclose. So then if they disclose, then they'll request records and sign consents and all that. But if they're not disclosing, they won't know to reach out. And that's because we really protect people's history when it comes to mental health and substance use, which I think is 100% necessary. So I don't think we have a very strong infrastructure really built yet to have a foolproof way, and I don't know that we ever will have a foolproof way. Nothing's ever going to be 100%.
Yeah, and I was just going to add, I think a lot of these questions are hitting that nail on the head, that there's so much still out there. But I think we have to kind of go back to the point that unfortunately, due to, and I'll say partisan issues or whatever, but we really only just started funding gun violence research in 2019 again. So in 2019 was when the US government said, yeah, we do need to fund this, and money was funneled both through the NIH and I believe CDC So now studies are more underway as to which interventions are going to be helpful, what isn't. So far, we all thought like educating kids about guns would be a higher intervention, but so far they've shown in studies that it hasn't really panned out. But what has panned out more so is just interventions such as inquiring and assessing the environment. I agree as far as what, we tend to focus on gun safety, but I think that's something that is more of what I call the initial steps in order to begin to really, as a country, really work on prevention. Because I think there's concerns once again about Second Amendment rights, which I think most of us are not saying no. We're not saying no about that, but more so, I think all of us focus on just keeping our kids, our adults, our citizens safer in general. So I think that's kind of the thing that we're kind of weaving through and trying to get a good safety net that will protect people's rights, but also protect people's lives. So, which includes suicide, homicide. Let's see, I think we have one more question. Can the effort to reduce gun violence be broadened to reduce all violence, such as knife violence, fist violence, ball bat violence, bomb violence, vehicle violence? Otherwise, aren't we in danger of playing whack-a-mole? So I will put that out to the group, or who wants to hit that one first?
I think the focus right now with firearms is just because of how deadly they are. I think that's really, again, systems, communities, there's a lot of things that come into play when it comes to violence as a whole. But firearms in particular are a main focus just because of the lethality right now. But I'll let some others kind of chime in.
I was going to say the same thing. I think that the problem of getting anything done is so huge that what we need is to focus on and pick our battles and go where the yield is highest. And then when we accomplish that, then move on to another. I think there's so many problems and things that need our advocacy and our attention. We can't do it all at once, and the guns are so lethal that we have to be more energetic there.
Okay. Dr. Shrestha, did you want to take us home before we wrap up?
I was just going to say that it's important to kind of focus on what, this topic, because it is something that hasn't gotten much attention in regards to prevention. And we all know, and we spent like 2 hours talking about how it has impacted our communities. So I think it is important that we are focusing mostly on the guns, and of course, other kind of violence is also what we don't want to kind of miss, but this one is something that I think we all should focus on, and there's better chance that it's going to improve if we do. So thank you. That's all.
Okay, well, I think we are at time, so I want to be respectful of everyone's time, so I want to thank you all for joining us for this presentation. I want to thank my speakers for putting in all this work and working with me with all my Star Trek references. And of course, AACAP staff, thank you. And Mr. Grant, anything you want to say before we wrap up?
Just thank you all for the presenters for fantastic data and resources that you had in your slides. Thank you for that and for rolling up on a Saturday. Also, thank you all the attendees for taking the time out of your day to participate. The slide deck will be available on AACAP's website at aacap.org/virtual forum. Plus, we'll start promoting it in news clips, so you'll see this come out to you as well. If anyone has questions, anyone has follow-up comments, please send them to communications@aacap.org. And we'll be sure to farm them out to the best expert on the panel. But other than that, thank you. Thank you very much, and enjoy the rest of your weekend.